Assalamu alaikum. Today we are going to study the fascia and the muscles of the anterior-lateral abdominal wall. So first of all we will see a brief introduction of the anterior-lateral abdominal wall. So the anterior-lateral abdominal wall, it will extend from the thoracic cage to the pelvic. Extend from thoracic cage to the pelvic. Okay, and superior to the abdomen wall. Superior to this abdominal wall, there will be costal cartilage of the 7th to 10th rib. Costal cartilage 7th to 10th rib. 10th rib. And also there will be the xiphoid process. These are present superior to the anterior lateral abdominal wall, and inferior to the anterior lateral abdominal wall there will be the inguinal ligament and the pelvic girdle. Inferior to it will be inguinal ligament plus the pelvic girdle. So this is a brief introduction of the anterior lateral abdominal wall. Now we will see the fascia of the anterior lateral abdominal wall, and we will study it from this diagram. So I will write here fascia. Okay, so now see here, then this is the outer side and this is the inner side. Okay, remember this. So the first one, there will be the skin, then there will be the superficial fatty layer, or we call it as the Kemper's fascia. Then there will be the deep membranaceous layer, or we call it as the Scarpi fascia. After that there will be the three layers, these which are in the dark black color, 1, 2 and 3. These three are collectively called as the investing fascia. This will be a superficial investing fascia or the deep fascia. This will be the deep investing intermediate investing fascia or the intermediate deep fascia, and this will be the deep investing fascia. Okay, and along with these there will be the three muscles of the abdominal wall which we will study later, and these will be the external oblique, then there will be the internal oblique muscle, and then there will be the transversus abdominis muscle. Next to this muscle there will be the endo abdominal fascia. Okay, and when it will surround the transversus abdominis muscle, it will be named as the transversalis fascia with regard to this muscle. Next to this fascia there will be extra peritoneal fat. After that there will be the peritoneal membrane, which has two layers. The outer layer, which I have shown in the pink color, it is a parietal peritoneum. Then there will be the peritoneal cavity which contains the peritoneal fluid, and the amount of that fluid is 50 to 70 ml. Then there will be visceral peritoneum, and after that there will be structures like the stomach which are present inside here, and this visceral peritoneum, it will surround those structures. Okay, we have discussed this part in our previous lecture also. You can see that there we have discussed it in detail. Okay, so we have seen about the fascia. Now an important point which we must remember here, that between the internal oblique and the transversus abdominis there is neurovascular plane. I will write this point here, neurovascular plane. Plane is present between internal oblique and transversus abdominis. Abdominis muscle. Means to say the vessels which will supply the anterior lateral abdominal wall, they will move between these two muscles. Okay, all these vessels will move between these two muscles. Now we will move toward the muscles of the abdominal wall. So first of all I will write the here muscles. So there are 5 pairs of the muscles in the anterior lateral abdominal wall. 5 pairs, and from these 5 pairs, the muscle, 3 muscles, they will be flat. three will be flat, and these three flat muscles, they are the external oblique muscle, the internal oblique, and the transversus abdominis. And there will be two vertical muscles. Those two vertical muscles consist of the rectus abdominis muscle and the pyramidalis muscle. Rectus abdominis muscle and the pyramidalis muscle. So these are the five muscles which are present in the anterolateral abdominal wall, and these three flat muscles, their aponeurosis will form the rectus sheath. Aponeurosis will form rectus sheath. The aponeurosis of all these three muscles, it will combines in the anterior lateral abdominal wall to form the rectus sheath. We will see this rectus sheath further in next lectures in detail, and you can see the origin and insertion of all these muscles from your books. So these were the important points regarding these muscles and the fascia. Hope so you understand, and if you don't understand any point, you can ask that in the comment section. Thank you.